Hello, everybody. Thank you for joining us and welcome to the next webinar in the series from the Association of Pet Bereavement Counsellors. I'm Kirsty, one of the founders. A few of you have met me before. And the subject of today's webinar is euthanasia and what happens at the vets. Before we get into it, if you're watching this as a recording, please consider liking and subscribing. It helps us get out to the wider community and allows us to share the wealth of knowledge that we have with as many people as possible, which is always the aim. I've been in veterinary now for a little over 13 years. And in the time I've been there, I've worked with numerous clients who have dealt with all aspects of euthanasia, pre-planned, emergency, aggression-based, surgery-based, all the whole lot. And we're going to try and cover as much today as possible, but we're going to be focusing on pre-planned euthanasia and what your client's journey will be when they make contact with the vet. It can start from the very beginning of them approaching you and saying, I think I need to do this. How do I do it? The idea of today is to give you guys as much insight as possible so you can then feed that back to your clients and arm them with the tools and the knowledge and the expectations of what they're going to face. As always, please pop any questions you have in the chat. I'll try and keep an eye on it as we go through. If I miss any, we'll pop right round at the end and pick them up. But as always, if you have any questions, please do ask. It's great to interact with people, and sometimes I waffle on a bit. So just a little bit of a disclaimer. If you've lost a pet previously, recently, or in the past and don't know what happens after you leave your pet at the vets, I am going to be going into it in a bit of detail. And it can be a bit of a trigger. So please feel free to step away from the webinar. We are recording this. You can always come back and watch it. It's not going to be too uncomfortable, but it's going to be factual. So please just feel free to step away, be kind to yourselves, look after yourselves. We can always pick up another time. So like I said, there's several types of euthanasia at the vets. There's pre-planned, so that covers anticipatory grief. There is emergency euthanasia, so that's your road traffic accidents, your sudden decline in symptoms of chronic conditions. There's death during surgery, which is always a really tricky one to navigate. So it thankfully doesn't happen that often. But when you've got a chronically ill patient or a patient that is having emergency surgery, sometimes it cannot be avoided. The problem we have with that is we lose the patient on the table, so the owner doesn't again get to come in and say goodbye. We've got euthanasia due to aggression or a neglect case. Can be incredibly hard on your veterinary teams as well as your owners. Neglect isn't always from malice. It can be a number of things, a number of contributing factors, and people are very embarrassed to bring their animals to the vet sometimes. The guilt that can be around that euthanasia process is quite large as well. And then we've got the really uncomfortable one that no one likes to talk about, and that's euthanasia due to financial constraints. I do feel like we won't get to that in this webinar. We can always pick it up in another one if anybody has any questions or anybody wants to, find out about that more, drop us a line and we can look into that. It is a whole topic in itself, and one that we have tread really carefully with. So as I mentioned before, my aim for this webinar is to walk you guys through the physical process of what your clients are going to experience when they contact the vet. A lot of you will have been on the client side already, if not all of you, unfortunately. And a few of you will have been in the career side, the veterinary side of it. But the knowledge is there to give to your clients, and so you are aware of the steps. So you can be armed with the explanations and things that they may or may not need. Excuse me while I check my notes. So we're going to go through the whole process right from the very beginning, right from calling through to reception. So if I was at a standard day at work and we got a call, generally the clients on the phone, they'll fall into two brackets. You will have clients who will be very cold and very calculated. They know what they want, they know when they want it, and they just want to get off the phone. They don't want to talk about it. They don't want to go into great detail. They don't want to know what happens after, they don't want to know what happens during, they just want to get off the phone. And it's really important to listen to your client and to work with what you feel that they need. There is always time for those discussions. And I do try and, get into that very, very short conversation. If you'd like to call back and book some time to have a chat with us about your options, please feel free to do so. Failing that, we can do it on the day. You are aiming to give them the information, to give them the space to be allowed to talk. A lot of people don't think they're allowed to ask questions. The amount of people who have said to me in the past, "Oh, I didn't think I could ask what happens." And absolutely, you guys need to know. You don't want to be caught on the back foot during these appointments. So the other type of call you'll get through to reception is your outwardly emotional clients. They often can't get the words out. They often can't physically say, "I am booking for put to sleep or euthanasia," and they don't want to be on the phone booking that call. But they also want to talk to somebody. And that's always a really good way for the team that's at work, the teams in veterinary, to actually just adopt that calm tone of voice and extend that time to them, because it might be that they don't have anyone to talk to, or it might be that they're being pressured into calling to book the euthanasia. And sometimes people don't have an outlet anywhere else. So it's important to let your clients know that if they need to talk to somebody on the phone, that first point of call, that call to reception, is where that's going to happen. And they're trained for it. They're trained, the teams at the front desk are trained incredibly well to sit and listen to those calls. I know listening should be easy, but it can be tricky when you've got 101 other things going on. But your clients are allowed to take up space, and a lot of them don't think they can. So having that conversation and just almost allowing the clinical team to lead that conversation is absolutely fine, and sometimes what we expect. Clients are sometimes really hesitant to actually physically move the conversation forward. The booking and the actual solidifying of the appointment is another hurdle that we often face. People don't have a time frame in mind. They don't want a time frame in mind. So you can give them the same day, you can give them the next week, you can give them the next month. They are allowed to pick. Private healthcare is a wonderful thing, and they're allowed to pick their vet as well. So I always try and say to people, if you have a preferred vet, ask for them. You are allowed to ask for them. So it's something else that I'd really like to have fellow counsellors understand, is you can say to your client, you don't have to just go with what you're given. You need to feel comfortable, you need to feel safe, you need to feel in that appointment that you've got the best space to do the worst thing. So ask for your favourite vet. If they're available, then they absolutely can be there for you. And then the booking times, it's tricky. We try to book around busy times where possible. So again, this is just looking at your long-term conditions that have deteriorated, or animals that are they've woken up and their old age has caught up with them. These are non-emergency, pre-planned, almost pointed euthanasias that we can create the best environment for. So we try to avoid busy times. We don't book on school kick-out or drop-off. We try not to book around rush hour, because people don't want to be stuck in traffic on their way to the vets with their animal in the car. And they don't want to be stuck in traffic on the way home either. So we try and keep it where as possible. Now, unfortunately, the clinic I'm in doesn't have a dedicated euthanasia room. And it's something that we are seeing more and more in the veterinary community and career path as we go through. A lot of newer practices, as a requirement, are having bereavement rooms, which is a fantastic idea. Unfortunately, where I am, as an example, we don't. So when our clients arrive for their appointments, they are faced with a waiting room. Not ideal, especially if it is busy. There's other things going on, there's noises, people don't like to show their emotions. So again, please feel free to say to your clients that they can ask for a room. I mean, if a room is available, they should be offered one anyway. It's just not always the case. However, most teams, if not all teams I've worked with, have some background plan. If everybody's busy, there will always be a side room they can place the client and the patient in that is quieter. It might not be the comfiest room in the world, but it's not on public display. So the arrival at the clinic, it can be a big thing for the clients. The pulling up to the clinic, the parking the car, they're all the last times that people are going to do these things with their pets. And that can get quite emotionally, weighted. So sometimes if you have a particularly vulnerable client, or a client is going to really struggle with that, we will meet them outside the clinic. We will go up if they're, friendly enough, or them well enough, they want a hug, or you've got some tissues, you can say, would you like a hand in? Sometimes the patient isn't ambulatory, so we have to carry them in. But it's that extra little bit that hopefully can make that journey a little bit more comfortable. So we will often meet them outside, or if their patient is in phrase another way, aggressive or completely non-ambulatory, but is a really large breed of dog, then we will get them to drive around to the delivery entrance. Now, it's not ideal, but again, it is more suited to that private, more cohesive affair. So there is always that option as well. So if you have a client with an 80-kilo Great Dane, they don't have to walk it through the front doors. The veterinary team can come to them either in the car, or they can arrange a home visit. Home visits can be quite tricky last minute in practice, but if we're pre-planning weeks in advance, then absolutely get them to ask for a home visit. Let's get the vet team out to them. Let's make sure that the animal is comfortable in their space. Failing that, we'll split back into the animal coming back into the clinic. So once they've arrived, you've got the actual physical appointment. And a lot of clients do believe that once the euthanasia appointment is booked, that's it. There's no going back, which is not the case at all. The appointment is there with the clinician to assess not only the patient, but the client as well, how the client is managing at home, how the patient is managing, if the quality of life is there. And that's a really big one, is the quality of life. Now, I know in the association's main course, the Living with Pet Bereavement Fund, put together by Dawn, she does cover euthanasia in practice and quality of life. We also use quite a lot of quality of life assessment papers to help clients understand where they can help and where they can't help, when the time is right, etc. So that appointment will invite the client to discuss with the vet. Again, you do have two very separate types of clientele. You will either get the ones that have made the choice and they don't want to discuss it. They're there to do the thing they don't want to do and then leave. And then you'll get the clients who are 100% unsure if it's the right thing to do. Both of these require time, expertise, and care from your clinic team. The client that doesn't want to be there and wants to leave, they still need to have the conversation of quality of life. They still need to understand that the procedure that's going to happen it cannot be undone. A lot of people are shocked when it happens. And it needs to be a very clear and concise conversation. Your client will need to sign a consent form to say that they consent to the clinician in question administering the drug that will stop the heart of the patient. They need to understand and sign that form. Again, that can be a big step for people. Signing that form is like, I've heard it referred to as signing a death warrant, which is awful. But legally they need to do that. So they can't, unfortunately, skip that step. So what my advice to our counsellors would be is, if you have a client that you feel may not be able to make that step, sign that paperwork, then they need to take someone with them that can on their behalf. Because the last thing you want to do is be fully prepared for what's going to happen and then not be able to do that last step. It's unfortunately a part of the times that we do need these legal paperwork filled out. So it's worth having that conversation with your client in advance to say, do you think you're able to do this? If not, let's take someone with us. Let's make sure we've got somebody on the phone that can potentially give permission on your behalf, that sort of thing. That also works if we've got a vulnerable client as well. So a lot of clients have support animals, support pets, and they are the primary owner, the primary carer for these patients. They need somebody with them for their own support in order to be able to help them make that step to sign that paperwork. So that is something that has to be done, unfortunately. Excuse me a second. The next step that would happen once your vet has had the conversation with the people involved, the client, the family, is once they've got the consent, is placing of the cannula. Now, it's worth noting in veterinary that cannulas are often referred to as catheters, which is not the same as a human catheter. So either cannula or catheter, fully replaceable terms. They are a line, an injecting line that goes into usually a forelimb, so that's a front leg, and it is there to administer drugs. It's an easy access, exactly the same as if we would be when we were in a hospital. It allows fluids, medication, obviously the euthanasia drug itself. It allows that to enter the system without stress. And that is another huge point, is we don't want these animals stressed in any way, shape or form. The cannula will normally be placed in the foreleg, like I say, in most canines and felines. If you have rabbits, they will go in one of the ears. And then small furries will have a slightly different process. So the smaller the animal, the smaller the rodent, there is a slightly different process because there's no accessible veins. But your vet will talk you through that in time. It does consist of having to use a little bit of what we call isoflurane, which is the medication that we use as part of our pre-med for general anesthesias. So we give them a little bit of that, and that literally just knocks them out a little bit to sleep. And then once we've got that, we can then move on with the actual procedure. So if we focus on canines, felines, and rabbits, we're either going to go in leg or in ear. Now, if we've got a particularly poorly patient, we can attempt to go for the forelegs. If we've got a low blood pressure, or we're specifically dehydrated, or we haven't got a great femoral pulse or anything like that, the veins themselves can be quite hard and quite friable. So sometimes you'll find that the cannula will go in a back leg because, and then you'll get a bandage on the front leg where we've attempted to but been unsuccessful. So what will happen mostly is the vet will take your patient, or your pet, sorry, away from the owner to place that cannula in a quiet, controlled environment. It's not there so you can't see it. It's there so the nurse can restrain correctly. The vet can then place the cannula with the minimal amount of stress. That is the key here. Once that's placed, the patient will then come back into the room. So again, it's worth mentioning to your clients that nothing happens other than that cannula placement when the vet leaves the room. No medication is given. The euthanasia drug itself is not given. Your patient will come back to you. Your pet will come back to you before anything happens. A lot of people panic at that stage because they think that that's when it's happening. But it is purely there for safety and stress management. Safety for the patient and also safety for the veterinary team. Regarding stress for the patient, there is an option. It's not widely talked about, but you can have sedation for your pet prior to euthanasia. Sedation is exactly what it says on the tin. It will make your pet go to sleep, but their heart will still be beating and their systems will still be working. So they will still effectively be live. They will just be asleep. Sedation is fantastic for our chronically stressed patients, aggressive patients, or patients that are in, unfortunately, a lot of pain. This can sort of cross over into your emergency patients, but if we've got a cat with a long-term chronic condition that comes in and it's uncomfortable, the condition is deteriorated, pain can be such a hard adrenaline push for them that they will almost fight anything that you do physically, mentally. So sedation is a fantastic way to make the entire visit more peaceful for everyone involved, including client and patient. So it is worth talking to your clients about sedation and whether they feel it might be necessary. It is starting to become more common in practice for routine euthanasias as well as emergent ones. So a sedation would be administered exactly the same as the euthanasia drug, and that would be through that cannula, which is going to be either in your front or your back leg or your ear if you're a rabbit. And that will just, it will slow the heart rate, it will relax the patient, it will put them in a sleepy state. They won't be responsive. So that is something to be very aware of. They'll still be alive, but they won't be responsive. But it will look peaceful. It will look like they're sleeping. They will still be breathing. They can still hear and see to an extent their owner. So they are still present in the room with them. They are just not reactive, which is quite often a good thing. So then you have the administration of the drug itself. Now, these drugs are quite often really brightly coloured, which is feels a bit of a contradiction. They are usually either bright pink, bright blue, yellow, or red. They are made like this on purpose, so they can not be mixed up with any other drugs. It can be quite shocking for the client. The amount of euthanasia drug that we use depends on the patient's weight, but sometimes it can look quite a bit. I'm just going to very quickly stop. I've got a question coming in. 2 seconds. I'll give it a read. Hi, Jacqueline. Thanks for your question. You did have sedation. Yeah. Oh, that's really. I'm really pleased they did that for you. Did you find, if you wouldn't mind answering, did you find that the sedation was effective in sort of calming your pet in the environment that it was immediately in, as well as the situation and the condition that they were in? Did it help the pet as much as it helped you, or your pet, sorry? I forget like to respond. I'll look out for your reply. But yeah, I'm really pleased for you. I'm sorry to hear that you lost your little dog, but yeah, sedation is a fantastic addition to the process. Oh, excellent. Oh, that's really lovely to read. It's nice when you have that rapport, and it's, yeah, no, I'm grateful for that. I'm grateful for you for that. Yeah, if we sort of circle back around to the euthanasia drug itself, like I say, it's very, very brightly coloured. This can be a little bit problematic if you've got children in the room, because they automatically want to know what it is. So we normally, explain to them that this is the drug that will end the heartbeat, stop the heartbeat, and it is brightly coloured, so we don't mix it up with anything else. Obviously, if you've got clients that are taking children into the euthanasia clinic, an appointment, then that's a whole step ahead, as it is. Different ages react very differently. But if your clinic team know that they've got children coming along, they will adapt. They are fantastic at adapting and providing explanations. So if your children are there and they want to ask questions, please do encourage them. In the long run, it will help them process. Again, age dependent, but in the long run, it will help them process. And it also makes the veterinary team approachable. What I often like to say to our euthanasia clients is, if you or the family would like to come back at any time, please do. Like, we are here for you to talk to. come in, get a cup of tea. Maybe don't do it over rush hour. But come in, grab a cup of tea, sit and talk to us. We are here. We can answer your questions. I think a lot of the fear around a euthanasia is the unknown. And I think kids have a lot of questions. And I often worry that parents are embarrassed for their children to ask questions. So again, if you have that family dynamic and they are going into that euthanasia clinic together, get them to write the questions down. Get them to interact and involve the children as much as is necessary and is appropriate. But the clinic team will happily answer any questions that they've got. The next little bit that we're going to come to is obviously the administration of the euthanasia drug and what happens afterwards. So this would be that time I mentioned at the beginning where it could be a bit triggering. So please feel free to step away if you need to. Excuse me. So the administration of the euthanasia drug, which is usually called Euthtal or something similar, will go through that cannula. So the line will be in the vein in the leg. And then you'll have a bandage around that vein around that leg, sorry, with a small cap sticking out of it, just on the joint. And the needle will go into a rubber bung. That rubber bung goes into a line, which will then go directly into the vein itself. So once that needle's in, the vet won't do anything, but they will ask the client, "Are you ready?" Sometimes they're not. Needle comes back out, not a problem. Again, we take our pacing from the client. There is no rushing here. You are allowed that space. Your clients are allowed to take up that space. Sorry, quick question. Hi, Jane. Oh, bless him. I have one of those very anxious cats, and it is something I think about an awful lot. To the point where if I think we were going to have a chronic condition with him, I would probably ask my veterinary team if I could have some sort of oral sedation to give him before I took him in, as well as sedation on the day. He's lovely to me, but he's horrible to anyone else. Sedation in cats is one of the biggest blessings we have. And I'm again really pleased that your clinic teams are offering this out now, because it just takes that panic away. And it's the one thing that we can't control for our pets. We can't control their panic. But sedation can help with that massively. I'm sorry that you lost your cat. I'm really pleased that sedation was an option for you. And it is something that I would really, really strongly suggest that we get talking about. We make people aware it exists, and it can be asked for if it's not already offered, and make it part of a normal process and routine. Some people don't want it, but most will quite happily accept it once they know what it entails and what it involves. So going back to the administration of the euthanasia drug. So once that needle's gone into that bung and the veterinarian has asked the client, the family, if they're ready, if they say yes, the drug is then administered. It is one solid fluid motion. It is not a stop-start. It is not bits and pieces. It is one plunge that goes all the way through, and it works incredibly quickly. So please, again, tell your clients that once they say yes, and that plunge goes through, that medication goes in, the drug works incredibly quickly, and it works by stopping the heart. So you often get a release of breath especially from dogs. You'll get a potentially a little bit of twitching from cats. Rabbits, you won't really see anything other than their muscle tone will change. So they often sit very hunched. They will make no audible indication that they have passed, but they will relax visibly. And dogs and cats do it too, but in bunnies, it's really only the only real outward telling sign that they've passed. I just very quickly read this one. Hi, Emily. Thanks for dropping your chat message in. Okay. So she says, I've always been incredibly privileged, and my brother, who's a vet, or a very close friend who's also a vet, have always done the dog euthanasias. 2 were sedated prior, 1 wasn't, but he was really ready and he went so fast. So I've always been with them. When my cat was euthanized, it was pretty brutal. Oh, I'm so sorry. As it was an emergency after an RTA. It was a totally different experience for me as I've only ever had planned and patient PTS experiences before. We always take ours to a crematorium after two, and they let you have time in the little chapel area. And I found this the most heartbreaking but beautiful thing. My children, who are aged 5 and 7, found it very healing to be able to stroke and kiss and say goodbye and cry all the messy tears they needed. I've also found that my children often get angry with grief. Brackets, I'm very absent and they're still understanding death, and it's all very confusing, and that can be hard. Thank you so much for sharing that. That's incredibly insightful. The we'll cover the time that you can have with them at the vets, but having taking your own patient, taking your own pet, sorry, to the crematorium can be a really nice thing to do for a family unit, especially when children are involved. Ages 5 and 7 are the trickiest ones. Like you say, they're learning and they're understanding, but they're still really confused. But yes, thank you for sharing that. That's I'm sorry your cat didn't have the best end there, but I'm glad you managed to say goodbye to him in a lovely environment. So the the administration of the drug is quick, as Emily's just attested to there. It does stop the heart very, very quickly. A lot of people are shocked by that. So please let your clients know that that is the point where they are saying yes, and it will happen. It goes through the system and it shuts the organs down. The vet will then use a stethoscope to listen to the heart, the chest, to listen to any breathing sounds and any heartbeats. Once both of those are avoided and are not there, they will announce that the patient has passed. They will then quite often leave the room and leave the family with the pet for as long as they need. We usually say, we're just outside the door, give us a knock. It can be 5 seconds, 5 minutes. I've seen someone sitting there all day before. It's fine. We'll work around it. Even if we are fully busy and running ragged, we will work around it. Your clients never have to feel like they are in the way, causing problems, taking up time. They are saying goodbye to their family pet, their family member. No one is going to rush them. When I lost my own unexpectedly at work, I spent 3 hours in the room, and I knew we were busy, and I knew they needed the room, and I couldn't leave. I couldn't drive myself home. And I didn't even know that they were doing all sorts of crazy things outside to accommodate. They were so professional and so lovely. And it is really important to allow clients to have that safe space. And let your clients know that they're allowed that. They don't have to rush off. Once they have processed and sat with their pet for however long they need, a lot of clinics will offer memorials, which is where counsellors and like our teams really do shine. We have that knowledge already. I won't go through what we can and can't do, but a lot of clinics will do base paw prints, nose prints, fur clippings. There are many other things you can do, and a lot of crematoriums, individual crematoriums, will offer quite an extensive service. So what I'd probably suggest you to do is have a look, if you haven't already, around your local area or the nearest crematorium to you, and see what services they offer, rough pricings of what they offer, so you are again armed with the knowledge for your clients. Forearmed is forewarned. The time spent with the patient and the pet after the euthanasia, we often have to say to people, and there's never a good time to say it, we often have to say to people, their body has passed and they have no control over it anymore. Again, this is attested to in Dawn's course, but they are unfortunately prone to releasing fluids and things. So we do often have to say to people, please be aware. If you are holding your pet or picking them up after they've passed, then there is a potential for used to get contaminated. Um, Obviously, if we've got children there, it's quite a difficult conversation to work around. Um, but it is really important that they are aware that that can happen because those fluids can be quite potent. Um, with the addition of potentially taking your pet home to bury them, um, obviously the drug that is used for the purpose of stopping the heart in mammals, and reptiles and the like, but in this case mammals. So if you are potentially, or your clients are choosing to bury their pet, they do have to be aware of the local wildlife, water tables, and just keeping that area free of children. Those drugs do stay active, they do stay quite potent for quite a while. There's a lot of information on the government websites of how to bury pets correctly and things like that, and your veterinary team will know a lot about it. It may be worth you versing yourself in those sort of those rules and laws if your clients choose that as an option, or sort of do suggest that they may want to look at that. 9 times out of 10 is fine, but it can just be a little bit problematic. Again, unfortunately, the bigger the bigger the pet, the bigger the animal, the more of the drug that we have to use, the higher the risk. Um, in addition to taking home for burial, you've obviously got communal cremation and individual cremation. So your veterinary team will talk your client through that, and they often have a partnered crematorium. They're not all pretty, unfortunately. Some of them, the teams that work there are lovely. Hands down, they're the most caring people outside of the immediate veterinary career path I've ever met. But unfortunately, the units that they're in are not always pretty. So if your client expresses interest in going to the unit to deliver their pet, please, please, please research it yourself first. They're not all approachable. There are some beautiful dedicated crematoriums across the country that will specialize, in individual cremations, similar to what Emily has mentioned, where you can go and you can spend time with your pet in an environment that's calm, quiet, safe, a space where you can cry your ugly tears, where you can sit and chat as a family, where you can have some quiet time on your own. There are some dedicated places, and they are fantastic. Again, the teams that work there, beautiful people, but they're not all like that, unfortunately. Also, not all units, are like that. So please do check out your local ones before you suggest your client to maybe take the patient themselves. Um, if your client chooses to leave their pet with the clinic, clinics will often only have one collection a week, and the body will be placed in cold storage. Cold storage in this case is often a chest freezer. So unfortunately, the process isn't pretty. The pet does have to be contained in effect a very, very large plastic bag for contamination reasons. Most clinics are not kitted out to have full walk-in cold storage units where each pet can be in their own section. So most clinics utilize chest freezers, and the pets and the bodies do have to be put into plastic bags and sealed. Each bag will have color coding. Color coding helps veterinary staff to understand if the pet is individual cremation, communal cremation, or if, for instance, it's wildlife. Wildlife, obviously, we don't, there's no charge for that. So wildlife goes into a different process. So there was also a bag for on hold, which is if your client hasn't made a decision about whether they would like ashes returned or not, by the time that the pet is euthanized, then clinics can hold the bodies post euthanasia. We often say to clients, don't worry, we'll keep them safe until you've made a decision, to try and ease that transition. Like I say, there is only one way to store them. Collections usually happen once a week, unless, and I hate this phrase, unless we have a particularly bad week and we have a particularly bad run of euthanasias, and then we can call for a second collection. So expectation wise, your client will have to wait a minimum of a week if they are wanting their ashes returned via a veterinary clinic. Say, for instance, if your veterinary clinic has the collection on a Thursday and your patient is put to sleep on a Friday, you then have to wait a whole 6 days before that pet is collected, and then a whole 7 days before the pet comes back. So the client can be facing up to a 2-week wait for ashes. Something to discuss prior to the euthanasia appointment, if appropriate, because sometimes that's a deal breaker for people. They will then find the extra funds to take their pet to a specific crematorium and have same-day service or a 2-day service. Some people will not want their pet gone from them for that long. Once that time has passed and your chosen cremation service has processed the body, the ashes are then returned to the vets. The clinic team will then call your call your client, and advise them that the ashes have returned. The one thing no one likes talking about, and I didn't know if we were going to fit it in, but we've got a little bit of time, so I might just cover it, and that's billing. Obviously, all of these services have a charge attached to them. A lot of clinics will not charge a consultation fee for a euthanasia appointment as a courtesy, but they do have to charge for the services of the connected cremation, connected cremation units and services. So they will often come with a fee. And there'll be an additional fee for a casket choice, whether you choose a scatterbox or a wooden casket or an urn. And then there is the physical fee, the drug fee. So the fee for the physical drugs used in practice. Again, a lot of practices will not charge time. So a lot of the consultations that you normally get charged are veterinary time. A lot of clinics won't charge that for euthanasia. They will just charge the drugs. It can be expensive. Again, the bigger the animal or the more medication, sedation, etc. that's needed can push that pricing up. So something to talk to your client about in the beginning is it's always a tricky one, but what are they expecting finances wise? Is the number they've given you realistic? Do you need to call the vet on their behalf with their permission, discuss pricings and things like that? A lot of clinics will require payment at time of visit. It is clinic preference. We don't personally, but a lot of clinics will, unfortunately. It's a question of six of one, half dozen another. Do you do it at the time, or do you do it when the patient returns to pick up the ashes? There's never a good time, but it does happen. It is something we do have to approach with people. A lot of people don't expect there to be a charge, so it's worth bringing into fruition before anything is booked, if appropriate. We've got a quick question from Jane. Hi, Kirsty. Do you think training as a pet doula would be a service that is needed? Have you ever worked with a doula? I've worked with one of our vets that I used to work with was a human doula, and her skills leached over into veterinary quite a bit. And actually, we had there was a bulldog in at the time that had to have a C-section. She was a really poorly bulldog, bless her. She had a stuck puppy. The owners were financially restricted, so they couldn't go for a cesarean section. And I do think it helped. I unfortunately wasn't able to be in the clinic as much as I would have liked to have helped, due to different duties needed. But I do think that having her there and having that training and that knowledge and also that calming demeanor did help. We did actually end up going for a C-section for that bulldog in the end. We covered the cost of the practice because the bitch was in pain, she was in distress, and it got to the point where not only was she going to lose the puppies, that her life was in danger as well. So again, clinics will flex if they need to, but I think training as pet doulas is something that we could seriously look at in the future. a lot of people would be quite receptive to it, I think. Um, Jacqueline says, Jane, I love that idea, especially having done similar with many friends and their pets. I would really be interested to have a chat with you guys about that because it's something that there isn't many people that do it, and I think it's something we could all look into and maybe sort of bring into the daily euthanasia clinics and things like that. So yes, if anybody wants to follow up on that with me, it'd be really fun. So that's pretty much from start to finish. You've done very well to listen to me for this long. Start to finish, what happens at the vets in the daily practice. I will say the veterinary teams that deal with this, unfortunately, are incredibly well trained in it, and they don't do their training specifically. They do it from experience, and they will more than happily talk to you as a counsellor ahead of any appointments booked for their clients. Obviously, you might not be able to get specific details, but if you want to pick their brains on what happens at their particular clinic, where their bodies go post euthanasia, how their teams work with families, children, if they have any, specific needs around sedation and things like that, I'd strongly suggest reaching out to your clinics and chatting with them, going for a coffee, making a point to meet up with them and just picking their brains. The more people know, the better we can help our clients understand the whole process. And I think it's really important. The more knowledge we have, the smoother and easier these appointments will go for people. Jacqueline said, would love to chat more about this. Oh, bless you. It's a wonderful webinar. Oh, thank you. And so useful to be able to direct caregivers too. You're very welcome. Thank you very much. That's very kind of you. Oh, Jane's thinking of becoming a human doula. Incredible. Ruby Wax is trained as a doula and she was talking about it first. I didn't know that. I'm definitely going to go look into that this evening. That's really interesting. I think I've heard her name in years. But yes, thank you everybody for coming along. Please, if you have any questions, pop them in the chat, or as always, you can put them on the Facebook group. Like I said at the beginning, if you can give us a like or a subscribe, that would be great. And if anybody has any further questions, please reach out to me. I could talk the hind legs of a donkey about how veterinary and counselling and euthanasia go hand in hand. Dave's popped up. He's happy to, yes, you can have my permission to share my details. That's absolutely fine. Yes, thank you so much, everybody, for coming. We're wrapping up 12 minutes early, so it's just time to go and get a cup of tea before bed. Have a lovely evening, everybody, and thank you very much.